I worked with 9 other students in the whole Daha Health Board area in both primary and secondary care. The primary care was just in GP surgeries, and the secondary care mostly took place in the main Carmarthen Hospital, Glangwili General. And we just went around and asked some of our patients, what can we do for you today to improve your experience? One of the things that we noticed, especially in secondary healthcare, was just how the patients and their relatives didn't feel as if the health board was actually communicating with them about the care that they were receiving and how everything was actually progressing. And they were often left out of that process because a lot of the time when the clinical decision is being made, it's being said in front of the patient but not to the patient, if that makes sense. So what we actually did, my colleague and I here on our own ward, we would go around after the ward round and just ask everyone, did you understand what exactly was going on the ward round? And if they didn't understand, then we'd try and explain it to them or get one of our seniors to come and explain. I think it will influence me quite a lot because before this I wasn't quite as aware of quality improvement projects as I perhaps should have been as a medical student. But I think that quality improvement is a very important part of being a medical student because we are the next generation of doctors, and whatever improvements can be made to healthcare will be as a result of our actions as well. I suppose to medical students especially, I think we are actually in a very unique position as students because we are part of the team, but we are also observers, and we're not quite as involved with care as perhaps as the actual doctors in the team. So we can sometimes see where the flaws lie or where things can be improved. And I suppose one of the tips would probably just be follow around with the doctors and just keep an eye out and always actually talk to your patients. And it's common courtesy just to ask, how are you today and what can I do to help you?